Well, maybe I should introduce myself first.
Yeah, absolutely.
My name's Chris Milburn, born and raised in Cape Breton, and I'm a doctor here in Nova Scotia for the last 18 years. I've been a physician now 22 years. You know, early in the pandemic, the whole healthcare hero thing was huge, you know. And I felt almost guilty because people didn't know, but I was sitting up in a half-empty emergency room. We were the quietest we ever had been. Our hospital was emptier than it ever had been. The halls echoed. There was nobody there. And yet I'd go for a walk on the street and people would, you know, social distance around me. They'd walk 10 feet by and they'd say, "Oh, you guys are heroes." And I didn't want to say, "I'm in an empty emergency room. It's really not that bad." So it's hard for us, I think, within healthcare to kind of admit, okay, look, this wasn't actually all that bad. Let's all stand down, because we lose our hero status that way. And right now, I think that's still in the public gestalt, is that we are heroes and we're working against this pandemic. And what people have forgotten is, you know, during COVID, worldwide, only 3% of people who have died of in the last year and a half. In Canada, I think it's only maybe about 5% of the people who've died in Canada since started actually died of. We forget that 95% of our patients who are dying of other things. They need our care for other things. And if we kind of admit that and we stand down, we lose face in a way. And I believe that's part of the reason it's hard for us to do that. Here's my take on why we've overreacted and we haven't been able to swing that pendulum, that heavy pendulum back. You know, when this first hit, we, myself included, we were all really worried about it, and it made sense to overreact at first, right? And the idea was, look, you know, our healthcare system could get completely overwhelmed. We were picturing people dying, gasping in the streets because they didn't have a respirator, and we had to do everything we could to work against that. The problem, as I see it, was it very quickly everything became a moral issue. So locking down became a moral issue. It's like, you know, if you care, you'll stay the blazes home. If you're a good person, you know, you won't sneak out and see your friend or your mother or whatever. You know, even if maybe they really need you to. Masking went from being like, does it work, does it not work, to it's a moral issue. If you're a good person, you wear a mask, and if you're not a good person, you won't wear a mask. And vaccines became a political, moral issue. And because it's become so polarized and it's become a morality play and a virtue signaling play, it's very hard for people to come down off their high horse. From within medicine, there's a couple of things that have gone on. So number one, I actually have sympathy for the medical officers of health. And, you know, the way that my comments were portrayed, you wouldn't think that, but there's this concept called asymmetrical incentive. So our medical officers of health have been scrutinized on one thing for the last year and a half. So nobody has asked them how many people have died on surgical wait lists, which are way higher because of COVID shutdowns. How many people have died of kidney failure waiting for dialysis? How many people have died of increased drug and alcohol use? I've never seen our medical officer of health asked once at a press conference or his feet held to the fire on that. But I've certainly seen every time a COVID death happens, it gets announced and you know, it's a big deal and whatnot. And we're counting. Most people in Nova Scotia could tell you the number of deaths we have. Not one of them could tell you how many people died of overdoses in Nova Scotia this year, and how many more than last year was it. So there's this asymmetric incentive on people like Dr. Strang to make sure you reduce deaths at all costs. And they've taken that very seriously. And it is a big cost to do that, but it doesn't seem to have mattered.